Hey guys, it's Kara. I had just a quick, pretty random video that I wanted to tell you guys about, and I just had one of my, I get headaches regularly, and I just had a regular headache. I just got up, and I'm actually deciding not to go to class now because I'm too tired and I have so much work to do, and I have this headache. It's not bad now. My headache was a lot worse a few minutes ago even. But I actually want to talk about how to avoid side effects from over-the-counter medications because, I don't know, if you've never had an illness that makes you overly sensitive, or if you just aren't a very sensitive person, then you probably don't have to deal with this. But even before I became ill with chronic fatigue syndrome, my body is just really sensitive. My skin reacts to random things. I have lots of allergies, and medications were a big deal for me. I guess what I do first is avoid taking anything for as long as I can. I mean, I don't suffer needlessly. I don't even know if that makes sense. I don't suffer just so that I don't take medication, but if I don't really need to take it, like if I have like a hand ache isn't something near as annoying and energy consuming as a headache. If your head hurts, that's like a main part of your body. It's really distracting. You can't do anything really. You can't think straight. Even just a minor headache can do that. So what I just did, one of my favorite medications recently is called naproxen, and that's just because it doesn't kick in as fast, but it lasts for so long. And a typical over-the-counter medication comes in an option where the first dose you can take 2 of them. I would never take 2 of them. I actually just now took half of one, which is my favorite way to avoid side effects. Let me see if I can find a side effects list on here. I'm not sure if there will be one. I don't think so. But over-the-counter medications that are deemed to be safe have just as many side effects as prescription medications. They are by no means safer or less risky. I mean, you take a little bit too much ibuprofen, you can bleed out from the inside, like in your stomach, particularly. I hate ibuprofen so much. Partially just because it's a medication that I react to stronger than other medications, and because before much was known about ibuprofen, it was thrown at everybody for everything, and people had no idea how much they were taking because there were no parameters to how much was considered an overdose. And even still, the amount that some people are recommended by doctors to take for like a certain length of time, like after a surgery, if they don't want to prescribe you a narcotic, they'll tell you to take a certain amount of ibuprofen, and that is an overdose. My significant other had his wisdom teeth removed, and he was having problems with the narcotic medication that they gave him, but they had also told him that if he runs out or he doesn't need the strength of the narcotic, he could just take 4 of the, I think it's 200 milligram doses, caplets of ibuprofen, and they didn't give him a time that he should stop taking it by, but they told him that he could take it for up to like, I don't remember if it was like 2 to 3 weeks or something like that after the surgery, not since he went off the narcotics. But that amount of ibuprofen is so much. And he was having trouble with his eyes. His eyes were so bloodshot, it was hard to look at his face because it was so, and he was having troubles, with urination because he would have to go all the time, and he would go, but then he wouldn't be able to go all the way, and that's another side effect of ibuprofen, especially if you're taking it for a long period of time or you're taking more than what's recommended. And he had only been taking it for a few days. He wasn't taking it for as long as they said he could. And that is ridiculous. And back to when there didn't used to be as strict parameters as there are now, my grandmother used to take ibuprofen for everything, and they didn't know when she was taking it, or so she says, that she didn't know that ibuprofen, if you take it a lot, it can cause headaches. So then she was taking more ibuprofen to treat her ibuprofen side effect headaches, and now she has this horrible stomach and intestine illness called diverticulitis, and she can't eat anything. There are so many things that she can't eat because she can't digest it, because the ibuprofen has destroyed her stomach. Anyway, this is not just with pain medications either. I guess I could list a few more pain medications that I do this with. If I am taking acetaminophen, this happens to be Midol, but it has acetaminophen in it. There is a maximum amount of acetaminophen that you can take in a day, or you risk severe liver damage. And this particular bottle has 500 milligrams per tablet, which is a ton, because if you get just plain acetaminophen that isn't this period-specific type, it is, I think, 325 acetaminophen. So definitely, I cut these in half. I often cut these in half unevenly and then take the smaller half. And then also aspirin. Aspirin is really strong for me. I can feel it making my heart beat differently because it's a little bit stronger of a blood thinner than other, I think they call them NSAIDs, NSAIDs, and ibuprofen is another one that's a blood thinner, so I can feel my heart beating differently if I take the full dose of aspirin, which is 325 milligrams, and it also makes my pee smell very weird, so I feel like that's something that should be taken with caution if it's making your bodily excrements smell differently. And the only other time that I have had that happen, a medication affecting the smell of my pee, is when I was taking, what is it called? I don't remember. It's the safe form of heroin. Morphine. It's morphine. I had my appendix removed when I was 12. That was before I had chronic fatigue syndrome, so I wasn't having any strong reactions to it or anything, but my appendix was very, very sick. It was infected and it was leaking inside of me, so I had to be in the hospital for a long time, and I had like a drain that was inside me, so all those things wrong, like the infection, the surgery itself, having the drain in me after I was awake, that causes a lot of pain and discomfort. So I had a button that allowed me to put into my IV a certain amount of morphine per hour, and even with the amount that they let me, it wasn't enough to get rid of the pain, I mean. But with that, it made my pee smell so weird, and that's the only other time that I've had it. And relating that to aspirin, something that's over the counter, that's insane. So another one, this is just plain Benadryl. You get 25 milligrams per tablet, and 25 milligrams is recommended for just daily decongestion and allergy treatments. You can take 50, which is 2 tablets of it, and that will make you tired, but it will 100%, or it's supposed to 100% get rid of your allergy symptoms. And also 50 milligrams is recognized as a sedative in the United States, but in the UK, up to 100 milligrams, which is 4 times the recommended dose, is recognized as a sedative. I have taken 50 milligrams once, and it completely knocked me out, but it wasn't good sleep. It was drug-induced sleep, so it wasn't good rest. But I was trying to use it as a sedative because I couldn't sleep. And when I take 25 milligrams, I still feel the tiredness. So I did have a video about my experience with allergy immunotherapy. I have so many allergies, and they got so much worse once I had chronic fatigue syndrome, and I was allergic to more things once I got chronic fatigue syndrome as well. And I do not take regular allergy medicine. I don't take it daily just because of the side effects, mostly. No one seems to understand that. They think that like I said, I'm just suffering for no reason, but my allergies are getting much better with my immunotherapy. I'm actually about to finish my treatment, and then I can get retested and decide if I would like to continue with it, and I think I probably will, but I don't know yet. Anyway, that is for some other time to talk about. So I split these in half. And then one other thing is, I actually forget what this is called, and I don't know where it is. Sorry guys, I found it. This is meclizine. You get 12.5 milligrams per tablet, but online I found that too much of meclizine can actually make you nauseous, which is what it's supposed to cure. And if you're already overly reactive to medications, something that is not actually considered too much can still give you the side effects. So you can take, you can take 2 to 4 of these at a time. I'm about to sneeze. I can barely take 2. 2 is usually too much. I can take 1 okay, but a half, I have one here, seems to be perfect. This is a little bit different. This is kava, and I got these to be super high dose just because it's a better deal if you can cut them into smaller doses. And 500 milligrams of kava is too much for your body, even for a normal person. And it says to take 3 of these per day, which is way too much. I have no idea where they got that. But I take a half or a quarter at a time. I used to take half, but then I tried a quarter and it works, so that's great. And kava is just used to kind of like calm down your nervous system, basically. It can help with anxiety, it can help you sleep, it can make just your body kind of just relax. It puts you in a calmer state. So anyway, that is my number 1 suggestion for reducing the side effects of over-the-counter specific medications. If you're wanting to reduce the side effects of a prescription medication, definitely talk to your doctor, because changing a medication dosage to yourself is not a good idea. Anyway, that's kind of common sense. But I will see you next video.